Okay, let's talk about induction. Inductions can be necessary for a variety of reasons. This could be because of gestational diabetes. That's a pretty common reason for induction. However, if your gestational diabetes is well controlled, then you might have a few more options, and that's something to talk to your care provider about. Other reasons for induction would be because of your amniotic fluid being too low or too high. Again, this can be in a range. Sometimes it can be more severe, sometimes it is more transient. So that's definitely something to also talk to your care provider about. That's a gray zone depending on how the care provider practices. Other reasons could be preeclampsia. That would be a pretty valid reason, as well as if you had extremely high blood pressure. There are also reasons to use Pitocin, which is artificial oxytocin, to help stimulate a labor or to help progress a labor that has already started. So this can be due to an uneven contraction pattern, or if cervical dilation isn't as expected, or but in any case, inductions are always something to discuss with your care provider about. A lot of times an induction could be because of going quote unquote past your due date, or because baby is too big. Those are less those aren't as medically indicated as some of the others, and so definitely be in a place where you trust your care provider and ask a lot of questions about the necessity of it. And if you feel like you need a second opinion, then definitely get one. But an induction in general is not the most pleasant experience, because it tends to take a long time, because you're starting from zero and you're pretty much almost you're starting in the hospital. You're not necessarily starting at home. So with the induction process, we're skipping all that lovely labor at home, labor starting on its own, all of that stuff. Sometimes somebody's water might break. You can again talk to your care provider about induction in that scenario. Typically, you can get 12 hours. Sometimes with home birth midwives, you might get more than that to really extend induction. Most people do start contractions within 24 hours of their water breaking, and so it isn't necessarily an emergency. So once you're at the hospital, induction can be done in a few different ways. The first is putting medication either into your vagina or taking it orally. And these are typically prostaglandins that are going to help soften your cervix. These might be something through that's inserted vaginally that helps do that, or it can be taken orally that helps do that. That is typically done if your cervix isn't quite ready for contractions. The second option is something called a balloon catheter, and this is a catheter that's inserted into the vagina, into the cervix, and it's filled with saline solution, so that the little balloon mechanically helps dilate the cervix, and once you reach 3 or 5 centimeters, it falls out. The next option is using Pitocin, which is given through an IV. And Pitocin is artificial oxytocin that helps stimulate contractions. Typically, you're going to get Pitocin after your cervix is already prepped and you're already maybe a few centimeters dilated. It would be pretty rare to have Pitocin without having any sort of dilation whatsoever. So Pitocin, however, is remember back where I said that contractions are your period cramps with an agenda? Pitocin is that for contractions, but it takes away sort of your natural endorphins that help you manage pain. And so Pitocin contractions tend to be a lot worse and a lot more painful and a lot stronger than regular contractions. However, you can still manage and do all of the great natural management things, pain management things, like walking around, being in a shower, taking breaks, doing all of your like movement things on Pitocin. You also do have the option for an epidural at any point in time. The biggest risks really with Pitocin is that you might need an epidural. It can also cause, overstimulation of the uterus. It can cause an effect on the fetal heart rate, and it can necessitate a C-section just because of sometimes the timeline or like the way that the body may or may not respond to an induction. But typically plan for inductions to take like a couple of days. They tend to be like quite long. So preparing yourself mentally in case of that.